All right, guys, welcome back. Dr. Ian Rassel here from Corrective Spinal Care of California. We're going to be sharing with you about pregnancies, and I want to remind you that a healthy pregnancy is normal and a painful one is not. I go on Reddit sometimes and I listen to patients, and it's common to hear people say, oh yeah, your normal lower back pain that you have with pregnancy, and I'm here to tell you that's not normal. And our approach is a unique one. You know, pregnancy should be a celebration of life, a miracle. And at our clinic, that's how we look at moms. If you're pregnant, there's a miracle happening. And in today's society, it's definitely not looked at like that. You know, you go to your hospital, you go to your obstetrician, your doctors, they're treating this like a condition, like a disorder, a disease, something with an ICD-9 code, and that is not the approach we take. This is a miracle, and we want to celebrate you, mom, and encourage your livelihood and vitality. And it's a simple approach, and I'm going to share it with you. I've been taking care of prenatal and pregnant moms for over 20 years, hundreds of mothers. We've had many breech babies flip using the Webster technique, which we'll talk about in another video. But it all starts with the initial visit. In the initial visit, we're going to sit down, we're going to have our consultation, we're going to discuss your needs, we're going to discuss, you know, what are your health goals during this pregnancy? Are you wanting to do this at home? Are you wanting to do this in a hospital? You want to use an obstetrician? Do you want to use a midwife? We want to be on your team knowing exactly what your goals are. And from there, after the history, we'll do our examination. And the examination is specifically to understand how well your body is moving. Are there areas that are not moving? We're going to palpate, feel your spine to make sure each segment is working properly. And if it's not, we're going to address those segments. So in the pregnancy, the one thing that makes the biggest difference is the hormone relaxin. This is a hormone that gets released, and it causes the ligaments in the body to stretch out so that mom's ready for more room for baby, so baby has more room, so the ligaments, particularly in the pelvis, get stretched out so there's more room for everything. And oftentimes when this happens is we're going to see pelvic misalignments, we're going to see subluxations in the hips and lower back that dramatically impact mom and baby. So imagine the nerves in your lower back, you can see right here, they not only go down the legs, but they also affect the reproductive organs in the uterus. So if mom has nerves being pinched in her lower back and her sacrum and pelvis, there's going to be less communication between baby and mom and baby. So this approach starts with specific chiropractic adjustments, and I want to share with you that the adjustments doesn't impact the baby at all. We're working around the baby, and we're using a technique called the Webster technique, which is just a beautiful approach to healthcare, where we're looking at mom's pelvis, making sure that the ligaments that go from the front of her hips all the way up, making sure from right to left, these ligaments are moving like they're supposed to. We're making sure the low back and hips are moving like they're supposed to. And this is going to encourage a healthy pregnancy. And the studies are there, guys. The studies show moms who have chiropractic care throughout pregnancy have less complications, they have quicker delivery, and report an overall better experience. This is our goal. This is our goal, is to make sure you and your family can grow healthy and can do so in a way that's empowering to you. So if you have questions about your pregnancy, or if you know someone who is pregnant and needs to reach out to a good corrective care chiropractor, please reach out to our clinic. We'd be happy to sit down and chat with you. We'll have that consultation. If we're ready to move forward, we'll do our examination and tests. And if we can accept you for care, and if you're a candidate for care, we'll show you exactly what it will look like. I hope it helps.